You've likely heard about COPD and lung cancer, but did you know they can appear almost identical? If you've ever found yourself short of breath or dealing with a persistent cough, you might wonder, is this just part of aging, or is it something more serious? Here's where it gets tricky. COPD versus lung cancer. The symptoms can look nearly the same at first. Both can cause a persistent cough, shortness of breath, and chest pain. But understanding the difference could literally save your life. The American Lung Association warns that early signs of lung cancer often mimic COPD symptoms, which can delay diagnosis and treatment. Welcome back to Golden Aging Health, where I'll walk you through 4 critical signs to help you tell whether it's COPD or lung cancer backed by medical science and real-world advice. This way, you or your loved ones can recognize the warning signals early, before it's too late. Before we dive in, don't forget to like and subscribe to Golden Aging Health for more essential senior health tips. Let's get started. Signs number 1. Onset and progression pattern. One of the biggest differences between COPD and lung cancer is how they develop and progress over time. Understanding the onset and progression of these diseases is crucial because it helps you identify the symptoms early and act accordingly. COPD typically develops gradually, often over years. It usually starts with symptoms like a mild cough or shortness of breath, especially during physical activity. Many people first notice they're having difficulty catching their breath when climbing stairs or walking briskly. Over time, these symptoms worsen and become more persistent, and that's when COPD becomes more obvious. According to the Mayo Clinic, chronic bronchitis and emphysema, the 2 main types of COPD, cause inflammation and damage in the lungs, making it harder to breathe and reducing the amount of oxygen that can be delivered to your body. Now, contrast that with lung cancer. The onset of lung cancer can be more sudden, and the symptoms tend to be more severe from the start. Often, the first noticeable symptom is a persistent cough that doesn't go away. Lung cancer can also cause unexplained weight loss, coughing up blood, or chest pain, particularly when you take deep breaths or cough. The American Cancer Society reports that lung cancer tends to spread quickly and may not show clear signs in the early stages, which is why it can often be misdiagnosed or missed entirely. So here's the takeaway. If you've had breathing problems that gradually worsened over the years, it might suggest COPD. But if your symptoms developed suddenly or intensified quickly, it's a red flag and you should talk to your doctor about the possibility of lung cancer. Let me ask you, have you or someone you know experienced a sudden change in breathing or chest pain? Drop a comment below and share your experience. Your story might help someone else recognize the signs early. Signs number 2. Biological cause and damage type. When it comes to the underlying causes of COPD and lung cancer, the differences are significant, and they determine how each condition affects your lungs and body. COPD is most often caused by long-term exposure to harmful substances, such as cigarette smoke, air pollution, and chemical fumes. Irritants trigger inflammation in lung tissue, gradually leading to damage. In COPD, harm mainly affects airways and tiny air sacs. Bronchial passages become swollen and secrete excess mucus, while alveoli break down, making oxygen transfer into the bloodstream more difficult. This causes chronic shortness of breath and difficulty breathing. Damage from COPD is mostly permanent, but symptoms can be managed through respiratory therapy, bronchodilators, and lifestyle change, especially quitting smoking. Although the condition worsens over time, proper care can slow progression. By contrast, lung cancer results from abnormal cell growth. It begins when genetic mutations occur in lung cells, often due to smoking or exposure to carcinogens. These mutations drive uncontrolled cell division, forming tumors. As growth continues, tumors may block airways and hinder breathing. Lung cancer is especially dangerous because it can spread to other organs. To bring this to life, let me share a real story. I came across George, a 68-year-old retired firefighter, had lived with COPD for years, likely from breathing in smoke during emergency calls. His lungs weren't being attacked by cancer cells, but the chronic inflammation and scarring from years of irritation had narrowed his airways and reduced oxygen flow. Now compare that to Martha, a 71-year-old retired librarian. She'd never smoked. Yet she developed lung cancer, a small tumor in her right lung that spread quickly, causing chest pain and unexplained weight loss. In just months, cancer cells had destroyed healthy lung tissue far faster than decades of inflammation could. Both had a cough. Both had trouble breathing. But as you can see, the underlying cause and the urgency of treatment were worlds apart. Here's where it gets even trickier. The early warning signs of both diseases can overlap, but their specific patterns tell two very different stories. Coming up next, I'll walk you through the key symptoms that most people ignore and how you can tell whether it's COPD or lung cancer knocking on your door. Signs number 3. Symptom pattern and warning signs. This is probably the part you've been waiting for. COPD and lung cancer may seem similar at first, but the way their symptoms develop is another major difference. COPD symptoms usually begin gradually and become more severe over time. In the early stages, individuals may experience a lingering cough and difficulty breathing during physical activities, such as climbing stairs or brisk walking. Over time, the condition often leads to frequent coughing that may bring up mucus. As it advances, even light effort can make breathing increasingly difficult. According to the National Institute on Aging, Colorado PD symptoms gradually worsen, often making it more difficult for seniors to stay active and independent. On the other hand, lung cancer symptoms can emerge more suddenly, and they tend to be more severe from the start. The hallmark symptom is often a persistent cough that doesn't go away or worsens over time. Other common warning signs include coughing up blood, chest pain, and unexplained weight loss. Because lung cancer can cause obstruction in the airways, it may also lead to difficulty breathing or wheezing. Lung cancer symptoms are typically more dramatic and can signal a more urgent problem, requiring immediate medical attention. When symptoms build up gradually over months or years, like ongoing fatigue, excess mucus, and worsening breathlessness, doctors often look towards COPD. But when signs come on suddenly, worsen rapidly, or feel deep, constant, and unexplainable, that's when we start thinking about lung cancer. Especially when there's persistent chest pain, rapid weight loss, or coughing up blood. This video covers the differences, but what about specific signs to look out for in everyday life? I've broken them down in 2 other videos, one on early lung cancer symptoms, the other on COPD warning signs in older adults. You can find links to those videos in the description below. Don't miss out on this helpful information. Signs number 4. Diagnosis methods and medical tests. Picture this. A 67-year-old man named Robert walks into his doctor's office. He's been coughing for months and feels tired all the time. He expects a quick prescription, maybe antibiotics, and to be sent home. But his doctor doesn't rush. Instead, she orders a spirometry test, where Robert breathes forcefully into a tube to measure lung function. The results show reduced airflow, a classic sign of COPD. That's one of the clearest differences between these 2 lung diseases. For COPD, the first step usually involves a physical exam and medical history review, particularly focusing on smoking or irritant exposure. The key test is spirometry, which measures how well your lungs function by assessing airflow. According to the American Lung Association, it's the primary test for COPD. Additionally, Chest X-rays or CT scans may be ordered to look for lung damage, and a blood test can check for signs of inflammation. In contrast, lung cancer diagnosis begins with chest X-rays or CT scans to identify any suspicious masses. If something unusual is detected, doctors typically perform a biopsy, removing a small tissue sample from the lung to confirm cancer. A bronchoscopy may also be used to take samples directly from the airways. So, persistent breathing problems deserve more than just cough syrup. Ask your doctor, is this something we should test with spirometry? Or get a scan to be sure? Your lungs deserve clarity. Have you ever had a lung test like spirometry or a CT scan? Drop a yes if you've had one, and share your experience in the comments. Prevention strategies for COPD and lung cancer. Here's a question I ask myself, and maybe you should too. If I could lower my risk for both diseases, what should I actually do differently? For COPD, the most important preventive measure is avoiding smoking. In fact, about 85 to 90% of COPD cases are linked to smoking. If you smoke, quitting is the best thing you can do, even if you've been smoking for years. Quitting can slow the progression of COPD and improve lung function. Additionally, avoiding exposure to secondhand smoke, air pollution, and chemicals is crucial. Regular physical activity and pulmonary rehabilitation can also help manage COPD symptoms. Even non-smokers can develop lung cancer, but smoking remains the leading cause. For those at high risk, like heavy smokers or those with a family history, low-dose CT scans may help detect lung cancer early. A healthy diet rich in antioxidants can also support lung health. The key takeaway here is that prevention is possible. Quitting smoking, avoiding irritants, and staying active are the most effective ways to protect your lungs as you age. I hope this video has helped you understand the critical differences between COPD and lung cancer and how you can take steps to protect your health. Remember, if you're concerned about any of the symptoms we've discussed, please don't wait. Seek medical advice as soon as possible. Take a deep breath, because we have just discovered the 4 most important signs to distinguish between COPD and lung cancer. We talked about how the symptoms appear, how the damage spreads, how they're detected, and most importantly, how to protect ourselves. Each difference matters because each one gives us power. The power to notice, to ask the right questions, to take action before it's too late. So if you're experiencing persistent coughing, shortness of breath, or even subtle chest tightness, don't ignore it. Speak with your doctor. Ask for a spirometry test or a low-dose CT scan if you're eligible. The earlier we act, the better we breathe for years to come. Taking care of your lungs is essential for healthy aging. I hope this video has helped you understand these 2 diseases and empowered you to take action for better lung health. If you found this video helpful, please like and subscribe for more information on how to live a healthier life after 60. And don't forget to check out the links to our videos on COPD and lung cancer symptoms in the description below. Stay healthy, stay informed. Thank you for watching.